Well, good morning, everyone, and welcome to our Zoom education session today called An Overview of Dementia. This presentation is all about understanding dementia, helps to increase our understanding of the various types of dementia that exist, including both reversible and irreversible types, as well as some of the symptoms of dementia. We're also going to explore how Alzheimer's disease, the most common form of dementia, impacts the brain and how it is likely to progress. But first, some introductions. My name is Allie Grady. I'm an education coordinator here at the, Chris, you lost our screen. That's okay. You want to see us for our introductions. I'm an education coordinator here at the Alzheimer's Society of Peterborough, Kawartha Lakes, Northumberland, and Haliburton. And I am here with two other members of our education team, Chris Van Leuven and Sarah Cook. And we are so glad that you're here with us to learn more about dementia. So we recognize that throughout our discussion today, there may be some questions that come up. Just in the interest of time, because we can't always see the chat function while we're sharing the screen, just if you can hold your questions to the end, and we will stop the recording and have time for questions at the end. That being said, if you don't want to forget it, feel free to write it down, or you can put it in the chat. Just know that we will get to it at the end. Thank you for your help with that. So let's get started. So just a quick agenda here of what we're going to talk about. So we're going to talk about what is dementia. We're going to go through some of the different causes of dementia. Like I said, the reversible and the irreversible causes of dementia. We're going to talk more about the types of dementia and some of the warning signs, and then some conclusions, and again, some time for questions at the end. So what is dementia? Well, the term dementia refers to a set of symptoms that occur when a person has a disease or a disorder of some kind in their brain. These symptoms vary depending on the person. They may include things like memory loss and difficulty with understanding, judgment, and reasoning. One of the most common questions we get asked here at the Alzheimer's Society is, what is the difference between Alzheimer's disease and dementia? And it can be a little bit difficult to understand, but we're going to do our best to explain it here. So Alzheimer's disease is just one of the brain diseases that can cause the symptoms of dementia. In fact, it's the most common cause of dementia, but it's not the only cause of dementia. So we have a cute little animated video to help explain the difference between Alzheimer's disease and dementia.
What's the difference between Alzheimer's disease and dementia? Perhaps you've been confused by these terms in the past, or mistakenly thought they were the same thing. Well, you wouldn't be alone, because knowing the difference between Alzheimer's disease and dementia can be tricky. But it's actually not too hard to understand. In a nutshell, it's like the difference between shortness of breath and asthma. Shortness of breath is not a specific disease. It can have many different causes, and asthma is just one of them. Likewise, dementia is not one specific disease. It's a combination of symptoms that has many different causes, including Alzheimer's disease. Still sound a bit confusing? Okay, think of it like this. You go to your doctor with shortness of breath. To find the cause, she listens to your chest to see if it's due to asthma or pneumonia. And then she checks your heart to see if your breathlessness is caused by heart failure or a very rapid heartbeat. She even asks if you've been worried in case your breathing difficulty is anxiety-related. After her examinations, she concludes that your shortness of breath is actually a nut allergy. Similarly, when dealing with dementia, your doctor needs to figure out the underlying cause. And while Alzheimer's disease is the most common cause of dementia, it's not the only one. Dementia can also be caused by vascular changes in the brain, Parkinson's disease, Lewy body disease, vitamin deficiencies, thyroid gland problems, chronic brain infections, or medications. Even a very deep depression can sometimes look like dementia, which means if someone you love has dementia, it doesn't necessarily mean that they have Alzheimer's disease. And that's very important for your doctor to establish, because some causes of dementia, such as infection, medication reactions, an underactive thyroid gland, or vitamin deficiencies, can be reversible with the right treatment. So figuring out the cause and a plan of action could improve your quality of life. And that's why, if you or your loved one have the symptoms of dementia, you need to see your doctor to find out the underlying cause.
I think that does a pretty good job of explaining it. But let's dive a little bit deeper. In this image, we see dementia as the overall overarching umbrella term. And the two boxes on either side of it show some of the common causes of dementia. On the left side of the umbrella, you can see the reversible causes of dementia. And on the right, we have the irreversible causes. When people hear the term dementia, it can be overwhelming because most often we jump to the conclusion that it's an incurable condition. But it's important to consider that second half of the umbrella to understand that not all dementias are caused by irreversible conditions. There are some conditions that, when treated, they can be reversed. The dementia can be reversed, including things like a medication side effect, nutritional deficiencies, metabolic disorders, like a thyroid disorder, even depression. So let's talk a little bit more about these reversible and irreversible types of dementia. So what do we mean really when we say reversible? In these cases of dementia, it is possible to improve memory outcomes and possibly to return to full cognitive functioning by treating the underlying condition. Again, often when we think of dementia, we jump to these irreversible types, but it's important to know that there are some conditions that can look like dementia and they can be treated. So let's look at some of these now. First one on our list here is depression. Sometimes the symptoms of dementia, such as withdrawal, an inability to initiate activity, and memory loss can actually be due to an underlying depression. Depression is highly treatable, and with therapy, medication, and lifestyle changes, the symptoms can improve and even reverse. Medications. Certain medications, like sedatives, can cause symptoms of dementia. Medication can also interact with each other. If you're taking several different kinds of medication, they can interact with each other to cause symptoms of dementia. And this includes, different prescription medications, but also over-the-counter medications, even supplements. A doctor or pharmacist can help to evaluate and alter medications if needed, if they think that some of the dementia symptoms are coming from a medication. A nutritional disorder. So vitamin deficiencies and dehydration over a period of time can cause symptoms of dementia, particularly in older adults. Again, these symptoms can be reversed with better nutrition, perhaps with supplementation and increasing fluid intake. Metabolic disorders like an undiagnosed thyroid disorder can also cause the symptoms of dementia. If a thyroid disorder is detected through blood work, it can easily be addressed with medication and monitoring. Other conditions that exist in the body that can cause symptoms of dementia include an infection, like a urinary tract infection or a UTI, or pneumonia, a brain tumor, even severe constipation. So the key takeaway here is that if a person is experiencing symptoms of dementia, it's important for them to see their healthcare provider to discuss the symptoms that they're experiencing and not to be scared that it for sure is dementia, because there may be a treatable condition underlying the changes. What do we mean by irreversible? While we mean that these types of dementia are progressive and degenerative, they do get worse over time. The brain damage that occurs with these conditions cannot be fixed or reversed. So if a healthcare provider has ruled out all of the reversible types of dementia that we just talked about, they may consider these irreversible types. So progressive disorders refer to diseases like Alzheimer's disease, Lewy body dementia, and Pick's disease, where symptoms continue to get worse over time. At the present time, there is no cure for these progressive disorders, so the brain will continue to atrophy or degenerate over time. Vascular dementia is another type of irreversible dementia and is often due to stroke. And we're going to talk about this a little bit more later on. Subcortical dementia, this is a small vessel disease. It impacts deeper areas of the brain. This includes things like Parkinson's disease dementia, Huntington's disease, which primarily affect motor functioning. Head trauma is an area that we've not yet touched on, but head trauma, especially that head trauma that leads to a loss of consciousness, can also create progressive damage in the brain that cannot be reversed. There's no evidence that one single mild traumatic brain injury increases dementia risk. However, there is emerging evidence that shows that repeated traumatic brain injury or even mild traumatic brain injuries, like those that occur in sports like football or boxing, hockey, even soccer, may be linked to a greater risk of a condition called chronic traumatic encephalopathy. You don't have to remember that. we call it CTE. That's another form of dementia. So this is kind of an overview of some of the irreversible forms of dementia. There are also ones caused by infectious diseases like HIV and AIDS, though these are more rare. Here's another image of that dementia umbrella, where the spokes of the umbrella represent the different types or causes of it. Under one half of the umbrella, you can see the reversible forms of dementia. You can see those are in the blue font. It starts at the top: medications, nutrition, so on. On the other half of the umbrella are the irreversible types of dementia written in the red font. You can see on the bottom half: Alzheimer's disease, Lewy body dementia. You may be surprised to see that there are so many different causes of dementia. But if you can believe it, there are even more types than are listed on this page. Some researchers and experts believe that there are over 100 different types of dementias that exist. So we're not going to have time to talk about all of them, but let's take some time to look at some of the most common causes of dementia in more detail so you have a better understanding of these conditions and some of their key features and characteristics. So in the following slides, we're going to look at 4 of the most common types of irreversible dementia: Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. So I'm going to pass it over to Chris, who's going to get us started talking about Alzheimer's disease.
Thanks, Sally. So we're going to take a closer look at the most common form of dementia, which is Alzheimer's disease. Alzheimer's disease accounts for between 60 and 80% of all types of, or all cases of dementia. And although the onset is gradual, Alzheimer's disease eventually affects all aspects of a person's life, including their cognitive abilities, their emotions, their moods, behavior, and the ability to carry out daily activities like eating and grooming. The disease is named after Dr. Alois Alzheimer, who discovered it over 110 years ago. It's been around for a lot longer than people might think. There's some different forms of Alzheimer's disease, and the 2 main types are called sporadic and familial Alzheimer's disease. We're going to talk about another form of the disease that's called young onset dementia in a little bit. The most common form of Alzheimer's disease is called sporadic Alzheimer's disease. and it has no specific family link. Sporadic Alzheimer's disease happens as a result of a complex combination of our genes, our environment, and our lifestyle. Sporadic Alzheimer's disease usually doesn't run in families, and it's not considered hereditary. Age is the greatest risk factor for developing sporadic Alzheimer's disease. And most sporadic Alzheimer's disease happens after the age of 65. Familial Alzheimer's disease is the second form of Alzheimer's disease, and it accounts for less than 5% of all cases. Families with this rare form of Alzheimer's disease have strong family histories of Alzheimer's disease where many family members have been affected over generations. Familial Alzheimer's disease is due to changes in specific genes that can be passed on from parent to child. If a person has familial Alzheimer's disease, their children are going to have a 50% chance of inheriting that disease-causing gene and developing Alzheimer's disease themselves. Familial Alzheimer's disease has the same symptoms as sporadic Alzheimer's disease, and it can develop at any age. When symptoms of dementia start before the age of 65, we use the term young onset dementia. Young onset dementia accounts for an estimated 2 to 8% of all dementia cases. While it's rare, there's 16,000 Canadians currently under the age of 65 that are living with young onset dementia. And people living with young onset dementia can be in their 50s, their 40s, or in some cases, even their 30s. As I've mentioned, Alzheimer's disease is a progressive form of dementia as the damage to the brain increases over time. It's considered degenerative because it causes brain cells to degenerate, shrink, or break down. And as more brain cells become damaged and eventually die off, the symptoms of dementia will gradually get worse. And as we noted, Alzheimer's is an irreversible disease because at the present time, there's no known cure, and the damage that has occurred in the brain can't be repaired. Let's talk a little bit more about degeneration and the physical changes that occur in the brain due to Alzheimer's disease. When brain cells degenerate and die, the brain shrinks as a result. At first, this shrinkage or atrophy, it's located to specific areas, but eventually the brain's total volume is depleted. In fact, the brain can actually shrink up to 2/3 of its original size and weight over the course of the disease process. This cerebral atrophy was first observed when Dr. Alzheimer studied the brain of Augusta Dieter, and she was the first person to be officially diagnosed with Alzheimer's disease. And the atrophy is still observed in people with Alzheimer's disease today. In the image on the screen, you see a comparison of the gray matter in a healthy brain on the left-hand side of the screen and a brain with advanced Alzheimer's on the right. Wherever you see those spaces and shrinkage, there's a loss of functioning to that particular area of the brain. The shrinkage directly translates to a change in behavior, function, or ability that that particular part of the brain is responsible for controlling. The shrinkage continues as the disease progresses, affecting the function of the brain and increasing the severity of the symptoms. It may surprise you to learn that memory loss might not be the first symptom of Alzheimer's disease. Changes in mood, behavior, or judgment might appear before memory loss is obvious. So over the next 10 slides, we're going to discuss the 10 warning signs of Alzheimer's disease. Before we get started, it's important that we note that while we've numbered these indicators from 1 to 10, they're actually ordered randomly. Someone experiencing the early signs of dementia might not have each of these symptoms. And although memory loss is common, it might not be the first warning sign for individuals in the early stages of Alzheimer's disease. I'm going to turn it over to Ali, and she's going to start with the first warning sign.
Thanks, Chris. So a helpful way to think about it is to contrast what's normal with what might be a concern. So as we go through, we're going to contrast a normal and what might be a concern. So warning sign number 1 is memory loss that affects day-to-day abilities. So it's normal to occasionally forget an appointment, a colleague's name, or a friend's phone number, only to remember them a short while later. However, a person living with dementia may forget things more often or may have difficulty recalling information that has recently been learned.
The next warning sign we're going to talk about is the difficulty performing familiar tasks. So busy people, we can be very distracted from time to time, and that might mean that we forget to serve part of a meal, and then we remember about it just a short time later. But somebody living with dementia might have trouble completing tasks that have been familiar to them all their lives, like preparing a favorite recipe or playing a favorite game.
The next warning sign is problems with language. So anyone can have trouble finding the right word to express what they want to say. However, a person living with dementia may forget simple words or may substitute words in a sentence such that it's not really, you're not able to understand what they're trying to say.
The next one is disorientation in time and space. It's common for us to forget the day of the week or maybe even your destination for a moment, but people living with dementia can become lost on their own street, not really knowing how they got there or how to get home. Someone living with dementia might have trouble finding their way back home after a visit to the grocery store where they've shopped for decades.
Impaired judgment can be another warning sign of dementia. From time to time, people make questionable decisions, such as putting off seeing a doctor when they're not feeling well, or perhaps choosing the fashionable outfit over the practical one. However, a person living with dementia may experience changes in judgment or decision-making, such as not recognizing a medical problem that needs attention, or wearing really heavy clothing on a hot day, or not enough clothing on a cold one.
The next one is problems with abstract thinking. So from time to time, people might have difficulty with tasks that require abstract thinking, like using a calculator, balancing a checkbook, or doing their taxes, which is probably impacting many of us right now as it's tax season. However, someone living with dementia might have significant difficulties with such tasks because of a loss of understanding of what numbers are and how they're used.
Another warning sign is misplacing things. Now, anyone can temporarily misplace something, whether it's your wallet or your keys. I know I lose my phone probably once a day. However, a person living with dementia may put things in places that don't necessarily make sense, like an iron in the freezer or a banana in the sock drawer.
The next warning sign is changes in mood and behavior. So we all can feel sad or moody from time to time, but someone living with dementia, they're going to show those varied mood swings where they're going from calmness to tears to anger, maybe in rapid succession and for no apparent reason.
Changes in personality can also be another warning sign. Now, our personalities can change in subtle ways over time. However, a person living with dementia may experience more striking personality changes, and they can become confused, suspicious, or withdrawn. Changes may also include a lack of interest or fearfulness.
And look, we just flew through those. We're already on our 10th warning sign, the last one, which is loss of initiative. It's normal for us to tire of housework or business activities or social obligations, but most people regain that initiative and they want to take part and they want to get their things done. However, a person living with dementia might become passive and disinterested, and they might require cues or more prompting to become involved. So while these warning signs apply to the most common type of dementia, we're talking mostly about Alzheimer's disease, they may also align with other types of dementia. And if you're concerned about any of these signs, the next step is to talk to your doctor. Only a qualified healthcare provider, after completing some assessment and tests, can confirm whether you or someone you know has dementia. One common question that we get asked at the Alzheimer's Society is, how long can a person live with Alzheimer's disease? As we've already discussed, Alzheimer's disease is a condition in which brain cells progressively degenerate. Alzheimer's disease typically follows certain stages, which can bring about a number of changes for the person and the family members who are supporting them. Because the disease affects each individual differently, the symptoms, the order in which they appear, and the duration of each stage can vary. In most cases, the disease progresses slowly, and the symptoms of each stage may overlap, and it's sometimes difficult to tell when that move from one stage to another occurs because it can be quite subtle. The entire progressive span of the disease can be anywhere from 2 to as many as 25 years, but the average is about 7 to 12 years. It's important to note that the Alzheimer's Society breaks down the progression of the disease into 4 stages, and you can see them on the screen: early, middle, late, and end of life. This is what we call a non-medical staging model. Healthcare providers might use a slightly different staging system using the Global Deterioration Scale, and that describes 7 stages. The terms mild, moderate, and severe Alzheimer's disease, which physicians may use, can loosely translate into our 4-stage system. Let's get started in talking about these stages. The term early stage refers to individuals of any age who have mild impairment due to the symptoms of Alzheimer's disease. Common symptoms include forgetfulness, communication difficulties, and changes in mood and behavior. People in this stage retain many of their functional capabilities, and they require minimal assistance. They may have insight into their changing abilities, and therefore they can inform others of their experience of living with the disease and help to plan and direct their future care. The middle stage brings a greater decline in the person's cognitive and functional abilities. Memory and other cognitive abilities will continue to deteriorate, although people at this stage might have some awareness of their condition. Assistance with many of our daily tasks like shopping and dressing and bathing will eventually become necessary in this stage. The late stage of Alzheimer's disease might also be called severe or advanced stage. And in this stage, the person eventually becomes unable to communicate verbally or look after themselves, and care is required 24 hours a day. Many individuals in the late stage either have nursing care being provided within the home environment, or the person is receiving daily care in a long-term care home. The goal of care at this stage is to continue to support the person to ensure the highest quality of life possible. People in the final months of dementia are going to experience both increased mental and physical deterioration. At the end of life stage, the person living with dementia may be able to speak just a few words, or they might not speak at all, depending on the level of impairment to their communication abilities. This stage is often referred to as a period of complete withdrawal and apathy. When the person nears death, comfort measures become the focus. As in the care of any person living with a terminal illness, physical as well as emotional and spiritual needs must be carefully considered and attended to, focusing on quality of life and comfort. Again, it's important to understand that the length of these stages varies from person to person and really can be subject to a range of health and lifestyle factors that are unique to the person. While there's currently no cure for Alzheimer's disease and we can't reverse the progression of it, present treatment options and lifestyle choices can often significantly slow the progression of the disease. Now I'm going to hand things over to Sarah, and she's going to tell us about 3 more of the most common types of irreversible dementia.
Well, thank you very much, Chris, and thank you for helping us to increase our understanding of Alzheimer's disease. So as Ali briefly touched on earlier when she was reviewing the umbrella of dementia with us, vascular dementia is a type of dementia that is caused by either damage to the brain from a lack of blood flow or damage to the brain from bleeding in the brain. So in order for our brain to function properly, it needs a constant supply of blood and oxygen through a network of blood vessels that is referred to as the vascular system. And when the blood vessels are blocked, or if they do bleed, oxygen and nutrients are prevented from reaching cells in the brain. And as a result of that, the affected cells can die off. Now, the location and the size of the brain cell death that's occurring, it really determines how the thinking and the physical functioning of the individual and how that will be affected. So there's actually 2 main types of vascular dementia. Subcortical dementia is caused by small vessel disease, and I know Ali mentioned this earlier. And in small vessel disease, that's where the small blood vessels in the brain, they become kind of stiff and twisted, and therefore that results in reduced blood flow to the brain. And this disease often damages the nerve fibers that carry the signals around the brain. Small vessel disease also tends to damage the deeper areas of the brain as well. Now, a second type that's called cerebral amyloid angiopathy. Again, you don't have to remember that term. But this particular type, it occurs when there's a buildup of amyloid in the brain's blood vessels, which can cause strokes to happen or bleeding to happen in the brain. And of course, in addition, the symptoms of dementia. And this protein, amyloid, is the very same protein that accumulates and forms plaques in Alzheimer's disease, which was what Chris was talking about earlier. So for those that are experiencing vascular dementia, the symptoms will differ from person to person, depending on the area of the brain that's affected. Someone with vascular dementia may notice changes in their ability to make decisions, to be able to plan and organize, and to look at and make those decisions for the future. Other changes may include difficulties with their movement. So they may have a slow gait and they may develop poor balance over time. Symptoms in this type of dementia tend to appear slowly, and specific impairments may occur in different steps. So When we think about vascular dementia, we often describe it as a stepwise progression. So the person's abilities can deteriorate because of the vascular changes that are happening, but then they may stabilize for a period of time. And then unfortunately, they may decline again. So we kind of refer to that as that stepwise progression. And while the stepwise progression is often characteristic of vascular dementia, it's not the only way that it can progress. So it can also be slow and gradual, or it can occur quite suddenly, depending on how the brain is being affected. Now, sometimes we may hear the term mixed dementia, and you might be wondering, well, what's that referring to? Well, mixed dementia is exactly as it sounds. It means that it has characteristics of different types of dementia. But by absolute definition, if you look up the term mixed dementia, it actually describes it as the combination of both Alzheimer's disease and vascular dementia. So that's the technical term, but we often use mixed dementia to refer to combinations of other dementias as well. So it could be Alzheimer's disease and Lewy body dementia, for example. So researchers don't know exactly how many older adults are currently diagnosed with a specific type, with that specific type of dementia that actually have mixed dementia. But studies are really starting to show that mixed dementia may be significantly more common than previously recognized. So as time goes on, it's not uncommon for perhaps a doctor or specialist to identify a second diagnosis and then to refer to it as that mixed type of dementia. And the concept of understanding mixed dementia is really important because the combination of those two diseases may have a greater impact on the brain than one all on its own. So that's really key. In terms of symptoms, you may be wondering about that. Well, it may follow a pattern that's similar to either Alzheimer's disease or vascular dementia, but it could also be a combination of both. Some experts recommend that mixed dementia should be suspected whenever a person has some evidence of both cardiovascular disease and dementia symptoms that slowly get worse over time. We're going to look at the second type here that's called Lewy body dementia. And Lewy body dementia is a term that was also mentioned earlier when Ali was reviewing the Dementia Umbrella image. Lewy body dementia occurs in between 5 to 15% of all cases of dementia. And it's a form of dementia that is characterized by abnormal deposits of a protein in the brain that's called alpha-synuclein, and it forms within the brain's nerve cells. The deposits themselves, so those clumping together of the proteins, they are called Lewy bodies after the scientist who first described them in the brain. And this process that leads to the formation of Lewy bodies is really unknown at this time. But what the research is so far telling us is that the areas of the brain involved in thinking and in movement, they appear to be most affected in this particular type of dementia. Doctors, unfortunately, do not know what causes Lewy bodies to form. However, Lewy bodies have the presence of a protein that is also seen in Parkinson's disease, which does suggest that the conditions may be linked in some way. So Lewy bodies typically affect the areas of the brain that involve thinking and movement. And there are two different ways in which Lewy body dementia is classified. So when cognitive symptoms appear first, so when that indication that the Lewy bodies are present in the part of the brain that's responsible for thinking and cognition, then the term dementia with Lewy bodies or Lewy body dementia is used. That's that classification. If, though, the physical symptoms appear first, with the cognitive symptoms developing maybe a year or more later, then the term Parkinson's disease dementia is used. So there's a little bit of a distinction there in terms of how those symptoms come about and how they develop. A person with Lewy body dementia may experience both cognitive and physical symptoms. Cognitively, the person may experience progressive memory loss. They may have some problems with language abilities, problems with reasoning and judgment, and other higher mental functions such as, using calculation. They may have a difficult time sustaining a train of thought. They may experience depression and anxiety, visual and spatial disorientation, and also fluctuations in their levels of alertness. Those are all different symptoms that could be experienced. Now, visual hallucinations are another common symptom that can be worse for people experiencing this type of dementia during times of increased confusion. So we'll often see those hallucinations get worse in times of confusion. For some people, Lewy body dementia may have a relatively rapid progression, and memory difficulties may not be a symptom that happens early on in the disease process. So other symptoms may actually be more apparent first. But we often do see memory loss developing as the disease does continue to progress for that person. Now we've looked at the cognitive symptoms, let's look at the physical symptoms. So the physical symptoms include muscle rigidity, or really stiffness of muscles, stiffness and shortening of muscles, tremors and shaking, a stoop posture, and sometimes what are referred to as kind of slow and shuffling movements. So the person seems to really have noticed some changes in their mobility. And it's believed that some people that are diagnosed with Parkinson's disease may also have Lewy body dementia in addition to the Parkinson's disease. I want to caution you, it does not mean, however, that just because you're living with Parkinson's disease, that you will automatically develop Lewy body dementia. So I want to make that distinction. Okay? It just means that some people that are living with Parkinson's disease are considered to be at a greater risk for developing the Lewy body type of dementia. Now, that's a lot of information so far. Let's continue to move on and talk about frontotemporal dementia. Now, frontotemporal dementia is another type of progressive dementia that occurs in between 5 and 10% of all cases of dementia that do exist. And unlike Alzheimer's disease, which generally affects most areas of the brain, kind of that global impact as the disease progresses, frontotemporal dementia is an umbrella term for a group of disorders that primarily are known to affect both the frontal and temporal lobes of the brain, hence the term frontotemporal dementia. And these areas of the brain are generally associated with our personality, our behavior, our emotions and mood, our language and speech, and also our abstract thinking and movement abilities. There's a lot going on in those two lobes of the brain. In some cases of frontotemporal dementia, brain cells will actually shrink and die off. But in other cases, the brain cells can actually get larger, and they can contain these little round silver Pix bodies. And often researchers will say they look like little tiny silver sequins. That's how it appears in the brain. And those are called Pix bodies. So Pix disease, or sometimes what is referred to as behavioral variant frontotemporal dementia, those two terms are used interchangeably. It's the most common type of frontotemporal dementia. And the main difference between frontotemporal dementia and other dementias is in the early symptoms. So in frontotemporal dementia, memory is often unaffected. Right? It's usually behavior changes and language problems that are the first things that are recognized or reported. Often family members and caregivers will report those changes far before they ever report memory loss. Symptoms of frontotemporal dementia, though, can include changes in the person's personality, in their behavior, and also in their level of judgment. And people with this type of dementia can act in somewhat uncharacteristic ways, resulting for care partners and family members in some potentially embarrassing or difficult social situations. In the early stage of frontotemporal dementia, behavior changes and problems with speech or language can appear separately. But as the disease continues to progress, these two areas will often overlap, and the language problems will continue to progress and affect the ability of the person to communicate. Over time, movement problems may occur as well, and the person may need more care and supervision. And unlike Alzheimer's disease, a person with frontotemporal dementia, they often remain oriented with respect to time, and they have preserved memory in the early stages. In the later stages, though, of the disease, general symptoms of dementia may also arise, such as, having that confusion, becoming more forgetful, and all the other symptoms of dementia that both Chris and Ali spoke of earlier. So that gives us kind of an understanding of frontotemporal dementia as well. So we really hope that this overview of dementia was helpful to you today. And, when we think back together, we explored what exactly dementia is. So we looked at defining that term dementia. We talked about the two main camps of dementia. So we talked about both reversible and irreversible forms. We took a bit of a deeper dive, into understanding more about Alzheimer's disease because of its prevalence. And we also looked at some of the warning signs and symptoms that may be noticed, how it progresses, how Alzheimer's disease progresses over time. And, finally, we reviewed some of the other most common types of dementia. So, that was a lot of information to digest in such a short period of time. But with everything that we've talked about today, it remains very important to recognize that a dementia diagnosis does not mean that your life as you know it has stopped. Research shows that an early diagnosis with proper intervention, it can really help to slow the progression of dementia. And this can help people to continue to have full and purposeful lives for a long time after diagnosis. While the symptoms admittedly will get worse over time, there are some treatment options and therapies that are available to help people to live well and to live as well as possible with dementia. So as I said, we know that we talked about a lot of detailed information in a very short period of time today. But if you would like to learn more about any of the topics that we've discussed today, we encourage you to visit our website. It's listed here on the screen. It's www.alzheimer.ca/PKLNH, which stands for Peterborough, Kawartha Lakes, Northumberland, and Haliburton. We also encourage you to speak to your client support coordinator or any of us on the education team about any resources that are available to assist you. Because that's, such a big part of the job that we do, is to help to locate and point you in the right direction of those helpful resources. So living with and supporting someone with dementia is not easy. We want you to know that you're not alone and that the Alzheimer's Society is here to help. We have a range of supportive services that are designed to assist you in your journey. And so, as I said, please do not hesitate to reach out to us if you have any questions, if you would like more information or further resources to help support you, but also to remember to speak to your client support coordinator as well, help guide you in this journey. And so our information for the education team is here on the screen. Feel free to jot that down if it's helpful to locate us. It's also on the website as well if you're looking for the email addresses and contact information of your client support coordinator. Just give you a moment to jot that down. And at this point, I'm going to stop the recording and then we can address any questions that you might have.